Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small presentation we would like to show you one of our cases of the month here made in our clinic. So thank you very much for watching and we hope you enjoy the video.
So let's start with this case, and I have to explain something to this case because normally whenever you see a dentist advertising for aesthetics, you only see a white American fence, everything done with veneers, and everything looks absolutely perfect and wonderful, but this is not reality, or only the reality for a very few patients who can afford and to do all the teeth, which is okay. But this is not dental artistry at its highest level. That's why I want to keep it real, and I want to show you a case as well where we have to blend in with our work into an extremely colorful and difficult oral environment. So this is for me actually the art of dentistry, that you have to produce something which blends into existing dentistry so well that you can't see it anymore. So this is the real art of dental technician work. So I'm very grateful to our dental technician Martha Orban from Munich in Germany. We have an incredible load of talent in our dental laboratory. I'm really happy. It took us now almost 10 years to assemble these great dental technicians, and they've done incredible improvements over the past years. So you'll see a case here which you won't see it's perfect because the initial situation is not perfect, but the dental technician work in this case is absolutely outstanding. So let's start. You can see the patient firstly doesn't like to brush his teeth. Color of the teeth is very yellow, cracks in them, grinding. There's a lot of things wrong with this tooth, but with these teeth. But he didn't want to have all American smile. He didn't care about his color. So do we dentists convince him to go all the way and replace everything and spend thousands of pounds with us? Or do we actually accept what the patient wants and just restore what's needed? So of course, in my practice, patient rules. Whenever it's medically okay for me to do what the patient wants, why not doing it? Why not satisfying our patients? So you can see the situation is not great. Of course, we have to tell him to brush his teeth better, which we did. Of course, we have to send him to the dental hygienist, which we did. But the interesting thing about this case is not that the patient is not brushing well or that the color is has yellowed over the years. It is that we have to blend in work within this incredibly difficult environment. So he had a cracked bridge on the top right. You can see that here on the left of the picture. So we take an incredible amount of time to take pictures to really prepare the technician for the colors. So we take pictures from the front, from the side, with different color samples, with different lights, with different flashes. Then we prepare the teeth, which is just the conventional way, and then take a digital scan, have a printed model, and then the technician mills the bridge out of the ceramic blocks. This is just the preparation of the teeth here on the printed model, and this is a finalized bridge, printed out, just painted, no veneering, so the risk of cracking or fracture of the veneer material is zero, because we don't have any. And the bridge is so strong that you can actually drive with a car over it. You won't break it. So bridge from the side, small gaps in between so that you can go through with an interdental brush. And color-wise, like I said, you'd see it looks very yellow. Of course, because we have to blend into the environment. This is a not so beautiful temporary, but it did its job for a week. And then the prepared teeth underneath. Cleaned the teeth. And you can see already from the try-in, the bridge will blend in perfect into the environment. Bite perfect, color perfect, shape of the teeth perfect, gum situation perfect. And you can see we cleaned the teeth of the patient a little bit as well. The gum inflammation will still take a few days to wear off, that everything is pink again, but absolutely perfect color. When I placed the work, I was really pleased. So this is a full ceramic bridge. As I said, no veneering, nothing, just painted the color, and that's it. So then the bridge placed into the situation just with the normal cement, and after 7 minutes we just remove the cement, clean everything again, and that's the final situation. And you can see from this picture, right, you can't see anything. So the technician has done an absolutely perfect job in color-wise, shape-wise, position-wise. You can't see anything. So I'm really pleased with this work, and you can imagine as a dentist, when you place those works, you have a really good day. Patient was very happy as well, and this is some work we do regular now, and we could send the patient home after taking the x-ray to make sure we have a baseline x-ray for future visits, and to check if the margins are okay, and to see if all the cements are out. So thank you very much for your kind attention. Sorry for sometimes praising ourselves a little bit too much, but I really enjoy placing dental restorations from outstanding technicians, and this makes our life so much easier. It makes the patient's life so much easier, and it's great that we reliably can place such works now. Thank you very much for your kind attention, and have a lovely day. Thank you.